We are currently a year and a half into a pandemic that has vastly impacted day-to-day life. Tragically, another health crisis that started long before has claimed an unprecedented amount of lives with minimal awareness and even less action. The war on drugs and prohibitive substance laws have created hazardous conditions for our communities. Years of government inaction have resulted in an unregulated illicit drug supply, often with potent additives that can lead to death. Substance-related policy failures have pushed communities to create harm-reducing solutions from the ground up. Supervised consumption sites like The Works have been created out of community-level care strategies rooted in the needs of people who use drugs. While the toxic drug supply crisis continues, many deaths have been prevented by the services they provide. But with over 530 deaths across the province in the last year, we know this crisis is beyond our current response. So where do we go from here?
This is where we have our harm reduction programming working out of here. We have a variety of services. We've got supervised consumption, a methadone program. We have harm reduction supply distribution, naloxone distribution, overdose prevention training, which is obviously really important right now with the overdose numbers being so high. We have nursing services. We have a new program which we just started recently, that is an opioid substitution program. It's a safer supply program.
Is it like a Suboxone or?
No, it's hydromorphone.
Hydromorphone.
So it's actually prescribing opioids for people.
Gotcha.
Which gets at the toxic drug supply. So that's what's causing the overdoses in the community, is that and people using alone, because then you can't respond to it, but really the toxic drug supply is the main driver. So our supervised injection sites right through here, I'm going to take you through. We've got a lot of COVID procedures in place right now, as you can see. But when somebody comes to use the site, they come in. This is our waiting room for all of our services. So someone will come in, they'll go through a COVID assessment, but whether or not they have symptoms of COVID or they're positive for COVID, they're coming in to use the supervised injection service. It's a life-saving service. We have to ensure access to that. They'll come into our intake room, which is right through here. Let's do a really quick intake. So a lot of this very low barrier, low threshold service delivery here. We give an anonymous code, so it's all anonymous in the supervised injection site. We have an exemption from the Canada drug laws so that people can use here without fear of arrest or prosecution for not just the people who are using here, but for our staff who may be in control of drugs at some point during someone's experience here. And so they have that protection. So we want to keep it low barrier, bring people in, but we also want to be able to intervene in overdoses in a knowledgeable way. So what are you using today? If somebody says they're using fentanyl, obviously we're concerned about that. But with the drug supply being so unpredictable, it's also possible that people will be using another type of drug and they'll overdose.
So for people who don't know, what is harm reduction and where do these services come from? Where do the practices emerge from themselves?
So harm reduction is really exactly what the name is, reducing the harms associated with drug use for people who use drugs. And here, the services that we provide are obviously for people in the city of Toronto. Harm reduction has been around for way over 30 years. It began as a social movement. It looks at social justice. It started with people who use drugs, who were trying to protect themselves, needed services, needed a different approach to drug use. So this is a health issue. We need a health response, not an enforcement response. So people really reaching out and creating these services and saying, this is what we need to prevent, at that time, hepatitis B, then hepatitis C, obviously AIDS, Now we're looking at overdose. So really creating those services for them. And the most important part of harm reduction is involving people with lived and living experience of drug use, not just to consult with or involved in some kind of ancillary way. It's really looking at involving people in the design of the services and the idea, what is it that we can do to support you? How can we change our services? And then in the operation, so actually working in services, really important in building trust with people, being able to relate to people, keeping those barriers really low, and in the evaluation of services. So, this is what we've done. What do you think? How can we change it? How can we make it better for people who use drugs? And really looking at involving not just, 3 or 4 people, a lot of people with different types of background, different types of drug use, different experiences, and then truly listening to that and implementing those things in the program. So harm reduction really looks at the involvement of people who use drugs, reducing harm, listening to people, offering things where they're at. It's non-judgmental, non-threatening. Drug use, as we all know, has been stigmatized. People who use drugs have been stigmatized and are afraid to come into services. So harm reduction has opened those doors, bring people in, connect with them, help them to get into other doors where they need to go, like hospital, primary care, mental health, so housing, so bringing them in and helping them get what they need. So it's really a wraparound kind of a thing. It's about the individual, not the services, not the people working there. It's got to be about the people who need that support. You'll hear fans. That's really to make sure that any of the fumes that are coming from heating drugs are going up and out of the space to protect staff, people who are using here. So people get assigned to a booth. Our staff are sometimes behind the desk here, but most of the time they're circulating around monitoring people. We have mirrors so that we can see the front of people to monitor if they look like they're starting to go down. Do they need to be stimulated to get them, see if they're overdosing or if they're okay and they're just high and that's fine. So that's what the mirrors are for. People will come in, they'll sit, they'll use their drugs, dispose of their supplies that they use into a sharps container. And this is one of the really important aspects of supervised consumption. This is one harm reduction service, I think all the harm reduction services also benefit the community, but very directly by having people use here. They're not out on the street. They're not overdosing out on the street so that people have to come upon someone and intervene.
How has the COVID-19 pandemic affected the lives of people who use drugs and their social determinants of health?
So unfortunately, I think this is, people who use drugs have always been marginalized, and COVID has just made that so much worse. So services at the beginning of COVID had to shut down, reduce hours. We had less staffing. We had to put protocols in place. That unfortunately, one of the impacts is the distance that, these are personal services. We need to be able to connect with people on such a level. And putting these barriers in place, like plexiglass and masks and gloves, and, I think it's been really hard for people who use drugs to be able to get in just from that perspective. And then the fact that services have reduced hours, people have been moved. So in the shelter system, a lot of congregate settings where there was no physical distancing. So a lot of hotel sites were opened and people were moved into individual rooms, which is great now because people have a place of their own. But then they're very isolated, or they may be, normally this is their community and they're moved somewhere in North York. So can't access the people that they know, the people that they get support from. So those were barriers that people had to face. I think during COVID, The city, through Toronto Public Health and Shelter Support Housing, have really worked to bring services into those shelter hotels, like supervised consumption, naloxone distribution, training shelter staff on how to respond. But people do feel very isolated and continue to feel isolated from their community. So it's been difficult. I think the other problem has been, where are people buying their drugs? So if they're moved to another place, they have to find a drug supply. And so that drug supply may be completely different, more potent than what they were using before. And during COVID, we've seen the overdose numbers, both the non-fatal calls to paramedics and the non-fatal overdoses in the shelter system at other locations really go substantially higher, with 530 people dying last year as a result of the toxic drug supply. So I think COVID obviously is a factor in those increased overdose numbers. So it's been really difficult for people who use drugs. So while they're here, if they start to look like they're going to overdose, our staff are monitoring all the time. We try to use the least intrusive intervention possible, because if you give someone naloxone, obviously you're putting them into withdrawal. That's not something that you want to do to people. You want to try to monitor, stimulate, oxygen, and then naloxone if they need to. We also try to deal with overdoses here at the site. Instead of having to call EMS, we have nurses and counselors. We have people with lived experience who work in here as well. And this is really a cornerstone of our program, and how the works, the involvement of people who lived and living experience in the design, the delivery, the evaluation of the services here. So people with lived experience are actually working in our chill out or after injection room all the time, helping to monitor people, helping people who are there to talk about any issues that they have, needs that they have. So once we move people into that space, it's really a good opportunity, because somebody has used, they're more comfortable, they're more in the frame of mind to be able to address some of the other things in their lives, rather than just trying to get high and do that. So it's a really, really good opportunity for that moment where somebody is feeling comfortable. We have somebody that they can trust, somebody who understands where they're coming from, who is not pushing anything. We're never really pushing referrals to service, treatment. It's whatever people want, whatever they need. We're really here to go with them where they need to go.
So currently, the Canadian substances strategy includes pillars of harm reduction and treatment. However, other pillars such as enforcement have been critiqued as non-holistic and punitive. How does state surveillance and the war on drugs impact the scope of harm reduction services, or otherwise interfere with the safety and well-being of people who use drugs?
So I think, obviously this is a health issue. People who use drugs need a health response. And, a lot of enforcement people have said, we're not going to arrest our way out of the overdose crisis. So from that approach, we need people to be able to safely access their programs. Supervised consumption services have exemptions to the drug laws that enable them to use without fear of arrest in those spaces. There is a movement right now to decriminalize possession in the city of Toronto, so that people who use drugs wouldn't be afraid that they're going to be arrested and convicted for possessing small amounts of drugs. And that whole movement is based on the fact that people don't get what they need through that process. We have a methadone program here, easy to get on that. They have nurses who can look at wounds and help with testing, with vaccination, a variety of other access points for service into mental health if somebody wants it or needs it. But this is a way to develop a relationship with someone, to support people, to say, we're okay with everything that you're doing, including coming in here and using drugs. And help to intervene if you overdose, and we're going to help you with whatever else you need. So really important just to be here where they are to support them. Really rough lives people have, especially right now with all the concerns about the drug supply and COVID. You know, people have been detached from supports, moved into shelter hotels, which is great for them to have a private place, but maybe detach them from their services. So really a time you need to be here and available and offering this service. So you can see we've got 5 booths right now that we have open. Probably see right now maybe 75 to 80 people a day. We primarily see men, you know, probably about 75% men, here 25% women. But there are other supervised injection services in the city who attract more women, which is great, or people who are younger. We see a kind of 35 to 50 age range male population. This is why it's really important to have a variety of supervised consumption services, not just one, because people need choice. They may not like this program, it's very clinical looking, you know, it's one of 9 services that they can access. Other programs are a bit more laid back, so it's good to have that choice.
Drug checking of Toronto's unregulated supply has identified potent synthetic opioids, occasionally mixed with other depressants like benzodiazepines. What steps can individuals take to prevent overdose from potentially potent substances, and how may responding to an overdose differ with high drug potency?
So I think it's really important for people to use supervised injection services, and there are 9 in the city that people can access, so that somebody can monitor, because the drug supply that people are purchasing from right now is so unpredictable. It's very toxic. They don't know from one day to the next, if I buy from this dealer, is he going to have the same stuff I had yesterday? Is it going to be more potent? Is it going to have a benzo in it? Is it going to have something else that may be very toxic in it? So having people go into services where there can be a response, letting people know if they're going to use, so that there can be a response, because you know, that unpredictability, like I said, what I bought even this morning, I buy from the same person, could be different this afternoon. So you don't know what's going to happen to you when you use those drugs. Drug checking is a very important part of the services that some of us in the city provide. It's right now, it's a good service that lets us know what's circulating in the drug supply, but we don't get the results for a couple of days. So it's not that immediate, I'm going to do this drug check and I'm going to know exactly what's in here, and then I can make an informed decision about whether or not I'm going to use it. We'll get there at some point, but right now what we are doing is collecting these samples so that we can send alerts out to the community to say, you know, the blue fentanyl had a benzo in it. So that the benzo kind of contamination of the drug supply has resulted in people really being hard to rouse. So people being out for extended periods of time. And that's dangerous for people who use on the street, who live on the street, because they have no protection then. So that's concerning. But the response, you know, you may use naloxone on someone, and you really do need to wait. So you get 1 dose and you wait that period. It's hard to wait that period of time and give the second dose of naloxone. Naloxone will work on the opioid. I think there's been some confusion about whether or not it works in a benzo overdose. Should people even be giving naloxone? You have to give naloxone to knock the opioid off the receptor. And then you see what you've got that you're dealing with. People will be, you know, monitoring vital signs, people not rousable in our supervised injection site for up to 2 hours. Sometimes people will wake up and they don't know where they are. It's really scary. So I think the drug checking is important, being in a supervised site. If you're using drugs, having someone there to respond to you and be knowledgeable about the fact that people may not wake up even though you've given naloxone. Don't give 5 doses of naloxone. Maybe you need to call EMS for that person because they may need medical attention or a safe place to be monitored for a longer period of time than what you can do. So I think we're in the sites we're seeing atypical overdoses where we have flailing, we have this extended being out and unrousable. We have people dropping like that. So it's been a really difficult period for people working in services. Always being on high alert. There's a lot of grief and loss and trauma in the group of staff who are responding, not just at these services, but in the shelter system, at community agencies for people who use drugs, who have lost loved ones. It's been a very traumatic time. And so we just have to keep going along and modifying and adding to our response and learning from people who use drugs. What happened to you when you overdosed, when you woke up? How could we have supported you more? So even asking those questions in that moment.
The after injection room that was over here, we're actually not really using it right now during COVID. But when it's open, it's a very low-key, low-light, comfortable. There's a TV in there. Like I said, people have lived the experience working in there and supporting people who come in, looking at their needs, especially later at night. When they're here at 9 o'clock. So where are you staying tonight? Have you got a place to stay? Can we make a referral for you? Are you going to be safe overnight? Let's look at a safety plan, even before your drug use, because we're only open 10 to 10. So people are out and using in the community. So what is your safety plan around that? Do you have a buddy who can watch for you, give naloxone? So really looking at those 12 hours when we're not helping people to develop music.
What are next steps that can be taken to transform our current prohibitive substance policy into one that's more aligned with public health recommendations?
I think decriminalization is obviously one step that we need to make. The Toronto Board of Health has recommended looking at a process, and there is a consultation going on right now. So that's one thing. I think we need to keep evolving our service delivery. Safer supply is another place that we need to go. So we're replacing the reliance on the toxic drug supply that's killing people. We need funding for all of those things. We need to move our view of this and change it. This is not criminal activity. This is not something that people need an enforcement or arresting response for. This is something that people do because they have pain and they have trauma and they like to get high and they need those supports so that when they're using drugs, they're not dying. We're reducing the harm. So there are a number of things that we can do, that we can evolve. But there's a lot that we know that we're doing right now. We're not doing enough. So we have supervised consumption. We have 9 sites. There's a cap of 21 that the province has arbitrarily set for Ontario. That's not enough. We know that that service saves lives. We should have a space, a chair at a community agency where people are trained and somebody can go in and use drugs there if they don't have somebody to watch them or they're not living somewhere where it's safe for them, so that somebody can intervene. We need to just do more of what we're doing. Safer supply, methadone programs, getting into treatment, housing, mental health services. So we know what works. We need the resources to keep doing it.
So when people come in to use the site, they're provided with all of the supplies that they need for safer injection, and really encouraged to learn about the supplies and how to use them. We have a variety of different sizes and gauges of needles that are appropriate for different kinds of injection. So that education is really a part of harm reduction. So looking at causing the least amount of damage when you're injecting to your skin, to your veins. So working with people around which needle do you prefer, why is it, encouraging people to use things like tourniquets, because people don't always do that. That also reduces the harm. And everything new, only used once, which is also important. We provide people when they come in with supplies to take when they're out in the community, and so that they have enough, they don't have to share, they can get supplies for other people if they need to. So really trying to make sure that there are supplies out there enough for people so that they don't have to share. So sterile water, cookers, tourniquets, needles, filters, everything new. We also give people naloxone. So we've got naloxone kits that we can get people to take home with them. We encourage people to take as many kits as they need, as many doses as they think they need. With the drug supply being so potent, they may need to have a couple of extra doses to be able to give to people. There are instructions on how to use it, but frankly, people who use drugs in the city of Toronto have been saving each other for years and years. And we've had this naloxone program in place for 10 years, just our 10th anniversary in August. Really important strategy, very concrete for people to take home, and the uptake on these kits has been phenomenal. I think this has saved a lot of people's lives. People have naloxone, they know about naloxone, they use it all the time. So we distribute a lot of these and really talk to people about having these available for them. There are other strategies when they're in the community, when they're not here, like the National Overdose Line that they can call to be monitored. So they can call that line and say, look, I'm going to use, if I don't call you back in 5 minutes or 10 minutes, do this for me, so that someone knows where they are and can get medical attention to them. So, buddy systems, naloxone kits, overdose lines, really important strategies, because services like this are not open 24 hours a day in Toronto right now.